A very warm welcome to you once again on the topical discussion. It's still the morning breeze that you are watching. And like I earlier on did say, we are honored to have the leader of opposition, the Right Honorable Mathias Mpuuga, who is also the member of parliament for Nyendo Mukungwe, to speak to us about some of the policy alternatives that his side, the opposition side, is providing to the government of Uganda, how feasible this would be, and also trying to assess the plan that government has, especially with the COVID relief funds in this lockdown. It's day 5. We're left with about 37 days to close in, but no one knows whether there will be an extension or no extension like it was in the very first case of a lockdown. And you can also get to us on social media, speak to us using @NBS TV on Twitter and NBS Television on Facebook. The hashtag is NBS Morning Breeze and NBS Updates. My name is Mildred Tuhai. Say a very good morning to you, Honorable Mathias.
Good morning, Mildred, and good morning, esteemed viewers.
A pleasure having you out of a very busy schedule. But maybe the very first thing is, how are you coping up in Parliament? Because we know that Parliament has been closed down now for 2 weeks because of the situation that we are having. It's another epicenter, if we would say so, because 529 members of Parliament, they keep interacting with the public and yet have to come back and do legislative work.
Yeah, I do agree because, and I think speaking about Parliament itself would be to miss the bigger picture. Members of Parliament are part of an infected society.
Yes.
So you cannot isolate them as Parliament. They come from the bigger community of infected people, and therefore they are as prone and vulnerable like any other citizen. So, but of course, administratively, Parliament has for the last 2 weeks sized down on staff. You discover, for example, that my office has just about 2 staffers.
Wow.
And they will alternate. And I believe so other departments. So we have taken measures to size down on the number of people in the corridors of Parliament. And members too. It's now very difficult to find at a single go more than 100 members in the premises of Parliament, which is a bit, unusual.
Quite unusual, but also there is the legality or illegality discussion about having just a few members of Parliament discussing issues of national importance, because we know also when it comes to issues that would necessitate voting, a particular number is needed. How are you looking at that stage? There is the health issue, but then there is the legal aspect of how Parliament has to sit and legislate.
No, at the moment we have not had a plenary session. Since members elected the Speaker and subsequently received the budget, we are yet to have a session that brings all members together, and therefore the legal requirement for numbers has not arisen. But in any case, if it does arise, like I had the Prime Minister propose that they would want to make some alteration in the budget, probably the Speaker will have to find a mechanism of making the numbers that are mandatory available, either via Zoom and ask whips to make available, the various party whips make available particular numbers that would facilitate the respect of social distancing and other forms of protection against COVID.
Okay.
Otherwise, at the moment, we haven't had an occasion that requires the sitting of all members of Parliament.
Okay.
Yeah.
Well, it's day 5 of the lockdown, a 42-day lockdown. We first had an inter-district ban, and then that was extended still once again. What so far are what have you so far denoted from this entire period as a leader?
Mildred, I did offer tidbits of my concern and the concerns of those that believe, like myself, that probably the lockdown, either deliberately or inadvertently, missed out on giving the country particular facts that probably could have aligned the population on the nature of problem. There's no denial as to the nature of problem we are facing. And these times, when the country is this desperate, when the country is this scared out of skin and the population is looking for answers, leadership demands that you actually, when you come out to offer as a leader what to do, you are unequivocal. For example, we have discussed variously the blanket lockdown without adequate information as problematic. You say you have banned inter-district movements, but the question of the day, where does the virus surveillance locate the epicenter before you lock down the entire country?
But the president had clearly highlighted the Central Business District, especially Kampala and Wakiso, as being the epicenters. That's
my point. I'm talking about then what stops somebody from moving from Gomba to Sembabule in their gardens?
There could be an issue. The gardens are still open, Right Honourable.
No, you see, the gardens are in different borders. That's why I'm saying the blanket movement, the blanket lockdown of the country without clearly explaining where the issues are is problematic.
Okay.
And you say, when you say Kampala is the epicenter, but then I can move from Kampala to Wakiso because it's the same metropolitan area, again, it becomes problematic. So the whole point I'm making is that the whole idea of a lockdown became problematic because, one, it is blanket. Two, it is simply an announcement of 42 days. The question of the day, that when we had the first lockdown more than a year ago, what did we undertake? And what did we achieve?
Okay.
And when you lock down the country subsequently after 1.5 years, what is the purpose of the lockdown? Are we hiding away from the virus?
To bring down, scale down the numbers of infections.
How do you do that?
By restricting movement of people, because the ministry officials and the president has clearly said COVID-19 is moved or is spread by us. I'm moving and spreading it to you or yourself to me. Doesn't that make sense to you?
When I stop at home and there's no arrangement for either vaccination or checking, so what have you actually stopped? That's the question we are raising, that if you lock down the country, that should be followed with plausible subsequent action, that we are locking down the country because in the next 30 days, we want to immunize 1 million people. And the immunization is mass immunization, but also targeted immunization. It can be mass and targeted at the same time, depending on how you want to work. For instance, initially when we had the first donation of vaccines, and I'm using the word donation on purpose, and I'll come to it. We targeted medical workers. We targeted the security forces because these are highly interactive groups. We targeted teachers because they interact with our children, which is also perfect. And that was it. And it was understandable. Mass to those targeted groups, and it does work. So when you subsequently lock down, what is your target and what are the numbers? For example, we know that government set out to immunize 21 million citizens. After 1.5 years, not even 1 million has been immunized, performing below 4%.
Do we have the monies approved to have these vaccines come through?
Mildred, we're not even speaking about money because the money we appropriated. We haven't even bought a single vaccine, but we are using donated vaccines.
For the benefit of our viewers, Right Honourable, how much did Parliament appropriate with regard to purchase of vaccines? Because I know we had to get this from the COVAX facility.
No, we did not. I don't have the actual on vaccines particularly, but we did appropriate up to 10 trillion for the entire, including purchase of ICU, ICU beds, medicines, vaccines, and relief. Close to 10 trillion was appropriated. And part of that was to procure the vaccines. And we haven't procured a single vaccine, but we have been lucky to have donations being brought. And the question of the day is what happened to the procurement? Somebody will tell you the procurements take long. Then I'll ask, when did you, can we know the date of your last pro forma to these suppliers? Because we know for a fact that the world is looking for vaccines. But what are the other countries doing that we are not doing? And so when you do not come out to explain to the country what you have tried to do, because you lock down the country initially, because when you lock down, you're trying to take measures. I would have expected the government to say we're locking down for 42 days to target another group of interactors. Say we are going to go for border cyclists, we are going to go for market vendors, we are going to go for taxi drivers. You don't simply say, people working in the market, you sleep there, we are going to bring mosquito nets. That does not help the cause.
And by the time of the lockdown, right, Honorable, we had 886,000 vaccines that had already come through. Have you received information on how these are actually going to reach out to the people because they can't move?
Yeah, I think that's part of the challenge, and that's part of the questions we're asking. So when you lock down, without explaining, you're saying on the day you lock down that you have received vaccines. Give us a knowledge of how you intend to reach the people that are locked at home, that cannot move. So the whole idea of a lockdown, without telling us how you're going to vaccinate and also do the testing, because the testing too is problematic, which is why we question and try to question whether there is adequate surveillance for us to know where the center, the problem is. You remember what happened when schools were closed en masse without, because, for example, I thought if it were me, before closing school, because the rumor was awash for almost a month, there was a problem in schools. Could the government have undertaken a surveillance to ascertain the veracity of the rumor about infections in schools before a blanket closure? Because my sense is that part of the problem in schools could have been contained within the school setup by way of checking, by way of testing, and even part of the treatment would have been undertaken there. Because our health facilities are thin in terms of space and capacity, probably some of the schools would have been utilized and turned into, high dependency units to be able to curtail, the spread. When we send children in the communities en masse, we actually now know what we did to the country. So some of the policies could have been thought through better. At the moment, we do not have a report on the disease surveillance for us to know the nature and the epicenters, the groups that are most affected in terms of the demographic spread, age group, in terms of, area.
But that was stated up. In the president's address, he did clearly mention the age group between about 18 and 30 or 35 and said it was spreading faster there. And there was another age group between about 6 to 19, which was also coming through.
I did listen to the president very well. The questions I'm asking are valid because the mapping wasn't clear to anyone. The mapping was scattered, and you could get the sense that probably he does not have a properly laid down report. If they had that kind of mapping, the blanket closure of schools should never have happened. Nor did we also raise questions as to the mortality rate going up. And the questions are rising as to the way patients are managed in the entire treatment protocol. And I don't know whether you have spoken to people who have survived, survivors of COVID, and the challenges they are facing in the health facilities. So when your patient is taken and they tell you to go home and leave the patient in the hospital, there's no transparency in the management of patients in these facilities.
Honorable Mpuga, talking about the mortality rate, which you are addressing right now, we've been told by the Ministry of Health the difference between the demand, for example, of oxygen supply for those in ICU vis-a-vis the supply. Like you clearly said, our hospitals, our health facilities they've been overstretched. What do you think more can be done? Because there is an aspect of demand and supply for the ICU patients.
Yeah, but before we go into discussing overstretching, what did they plan for? Can we know what they had planned for to the extent that we appreciate the level of stretch? We're talking about the fact that when the country was locked down in the first place, nothing was done by way of planning. We are asking questions as to how much was invested in procuring oxygen cylinders, and we are not getting answers. We are asking questions, how many HDU and ICU beds were procured? The answers are not coming through. How many regional referrals were properly supported to be able to deal with the pandemic eventually, to deal with where we are? And the answers are not coming through clearly. So we're talking about the fact that the country is stretched. When you locked down the country in the first place last year, you were planning to avoid this kind of scenario. So we are saying somebody slept on their duty, and the reason why the leaders that are supposed to be giving solutions are complaining as the entire population, and then say, we're supposed to give the answers. So do not tell me that I gave you 10 trillion and you instead bought tear gas and not oxygen, and that I'll listen. That we gave you 10 trillion to procure ICU beds, and you bought pickups for RDCs, and you want me to listen. So there's a problem. So we want the government to explain the priorities. We are aware that even the Auditor General is questioning these procurements.
Sure.
We have reports of these botched procurements, of forged procurements, of procuring non-required items, So we need to know, if the government here is serious, we want to know who has been prosecuted or is being prosecuted for where we are because of the problem we are facing as a country. Because the money, you can tell me the money was not enough. And I agree, we cannot have enough in our situation.
Yeah.
But what did that little do so that we can speak about prioritization in the circumstances? We offered that if, as we wait to prosecute the culprits, can we then look back into the budget and avail more money? Because if people are dying, we cannot be lamenting.
So you're looking at a supplementary in the nearest future?
No, we don't have to do supplementary. We can rejig the current budget. There's a lot of redundant money that can be utilized. Money for workshops, money for travel, money for special meals, there's a lot of money flying around. A lot of money for set house this, set house that. That money should be now rolled back, turned back, and converted into money to fight the COVID-19. That money is in trillions. It can be looked at clearly, which is why we are asking the Minister of Finance to return to Parliament, probably work with the Budget Committee to change a few things and return to the plenary, and we readjust the budget to take care of this emergency.
Okay.
It is feasible, it is possible. We know the money is there.
Thank you very much, Honorable Matthias Mpuga. We'll be taking a very short break. Quite a number of policy alternatives being suggested by the Office of the Leader of Opposition and the opposition side as whole. Will government be taking up these proposals? But also, is there anything that government has done right? And with regard to the COVID relief fund, what does the Leader of Opposition think about the mobile money cash transfers? That and much more when we do return. Welcome back. You're still watching NBS television. It's a morning breeze, and with me still in studio is the Leader of Opposition, the Right Honorable Matthias Mpuga, getting to us deeper into some of the policy alternatives with regard to dealing with the COVID-19 pandemic and how best Ugandans can be able to stay in the lockdown but still remain afloat. Honorable, you talked about a blanket lockdown and said there is not a lot of planning that had been put in place. And you suggested, for example, mass testing and immunization. Apart from that, that serves for the health side, but the welfare and social issues that people are complaining about, and that's the reason many have decided to defy the lockdown and want to move to get to their workplaces. What social alternatives are you providing, or do you think could have actually been applied in this 42-day lockdown?
For the record, we are not opposed to the lockdown. What we are opposed to is a lockdown of the blanket nature and without breaks. We are for a structured lockdown.
Okay.
in a sense that if you lock down the country, do it for 2 weeks, break for 5-7 days, and test the veracity of your actions, whether what you actually did has had impact. That kind of break offers a window for people to resuscitate livelihoods. I'll give you an example. Mm-hmm. If you have people that live hand to mouth and you do not offer them a window to go and make 50,000 shillings that will take them for the next 2 weeks, then you're creating a problem. So you're going to have more people dying of starvation. You're going to have people dying of malaria. You're going to have people dying of stress, killing them, because you slapped a blank lockdown. We are saying lock and break, lock and break, lock and test, lock and vaccinate. So that's how you do it. Other than saying we have locked down the country, we are going to send you money. If you have ever received money on your mobile phone more than 200,000, you do not qualify. Of course, that was most ridiculous. It would have been done better. But because the government is not in position to give everyone, it's the reason why the lockdown must be cascaded and structured to allow for people to self-sustain, because government won't sustain them. The lockdown measures missed out on the welfare principle.
And government is now suggesting mobile money transactions because the food was misappropriated, but also realizing that some people's problem may not be food in the lockdown, but something else. And therefore saying, we will give you mobile money. What do you make of this other option?
I actually agree and support the giving the cash option, because in a country where we do not have a properly constructed basic basket, a basic basket that takes care of the CPI, the Consumer Price Index, probably people's tastes and preferences in the basket are different. So you're better off giving them some cash, and your families will choose on their own democratically what they would rather have with the small money that will be advanced. The challenge is the modus operandi. How are you going to get people to receive this money without again donating it to those who store the beans and the posho? And
what would you suggest?
We believe that the mobile money option is extremely limited, because my sense is that the target group, the vulnerable, probably are the same people without a mobile phone. And the Prime Minister said they would use vouchers in that category. And I have not understood the nature of voucher arrangement they're talking about, because I think if the Prime Minister and government, by extension, believes in the capacity of community leadership, which of course over time has been abused, the community leaders, the LCs, are in good position to understand the vulnerable in their midst. I would rather that the executive of the village sits, they have names of their residents, they are able to figure out which individuals can receive. If, for example, everyone is not going to receive, the executive should be able to sit and determine the most vulnerable. We have widows, we have orphans, we have the disabled, we have, professionals whose employment has been terminated, the teachers, and structure out which people to target first. Because they know who their residents are and who the vulnerable are. A blanket use of mobile phones is untenable, because there are so many people bearing mobile phones not in their names. Sure. So you'll find Matthias Mpuga with a mobile phone, and the money, the mobile phone says Mildred to Haise, when actually it's being in the hands of Matthias Mpuga. So when it comes to, they say you actually have received. So it's problematic. And in an environment where the spread of national ID is still thin, I think reaching out to the LCs would be a better option. It could be much more transparent. The locals have their way of demanding for accountability than the upper offices. The locals actually can enforce accountability. If the monies are democratically declared, the locals, I can assure you, will enforce accountability, because They know their leaders, they voted for these leaders. With this pretendency of the higher local governments, they can do, I think, for me, a better job than blanket use of mobile phones.
NERA statistics, the Prime Minister said they would be using NERA statistics for these mobile money disbursements.
Of course, I've talked about the fact that there are so many people bearing mobile phones not in their names.
Yeah.
So the NERA stats are not foolproof.
Okay.
Yeah.
Looking at the role of Parliament in the fight against COVID-19, because you are the representatives of the people, and when it comes to appropriation of money or whatever discussion, the people are always looking back at you. How would you rate the performance of Parliament in this fight?
I think Parliament did its part. When we first had the first request of government, of course, all of us, the entire country was in panic and demanded that Parliament does act on its duty. We were stampeded. I must state that Parliament was stampeded because everyone was scared. The levels of scrutiny were probably limited, and it gave a blank check for gatherers to descend on this money, which is why now accountability is problematic. But as far as Parliament is concerned, I think we discharged our duty quite well because we were sensitive to the fact that we could plunge into a very serious problem, and we made money available. Even citizens were very generous. They donated in cash, they donated tools, they donated drugs, gloves, masks. So we believe we discharged our duty well. And you see, again, talking about cascading the lockdown, one of the measures we talked about was that in the epicenters that have been mapped, surveyed and mapped, intensity of SOPs could be enforced. There were lots of donations of water tanks, jerry cans, soap. I would love to see them now in these urban centers. That when you open up Kampala for 5 days, for example, ensure that for every arcade, for every entry, there is a jerry can, there is a tank. Where are these tanks that were donated by citizens and companies? I want to see them now at work. That when you close for 14 days, we announce you are open on Monday for 5 days, strict observance of SOPs as we test the veracity and tenacity of our actions over the last 14 days.
Okay.
That can offer a window to sustain livelihoods while you're trying to contain the pandemic.
Do you think Parliament learned lessons? Because you've talked about being stampeded, you've talked about the panic, which could have also led to low levels of scrutiny. What's going to be different in this case? Because we clearly see that we're back to the same situation where we were about 1.5 years ago.
No, my sense is that Parliament has learned its lessons because the Auditor General has a report that has forwarded to Parliament, and we had to scrutinize it. And it indicts the entire process, procurement, but it's not indicting what Parliament did, because Parliament did its duty, discharged its duty by making funds available.
Probably you're part of that problem that not a lot of thought was put in,
Yeah, of course I have explained the background that the circumstances warranted that we actually waive a few scrutiny requirements to allow government to have money to spend. But now, as it turned out, some of the money actually was not expended. Some of the money was actually simply thrown away, meaning that either individuals that are supposed to do their work are not aware of what they're supposed to do. I'm looking forward to the Minister of Health and Minister of Finance coming to Parliament to explain how they utilize the money we voted in the last financial year as a way of giving us a background on what we did not do and do it better this time around. So I believe that the waiver and the lifting of some of the conditions by Parliament were justified because we wanted to act fast
quickly
and avert a catastrophe. So, but that should never have been abused by the people entrusted to go and act on our behalf. That's why you're questioning whether they really had the will to do good.
Okay. Your views as an opposition leadership are simply advisory, one would think. And these are suggestions that government could either take or ignore. What would happen if these views are ignored on your side, or how do you even intend to push further as leaders, because at the end of the day, you are leaders, to push further that if government is not adopting some of your views, you can actually see how these could be implemented on the other way, because you still represent Ugandans?
You know, Mildred, this for me is a time when real patriots should come out. This is not time to trade political blows. It's not time to really to try and show that, you know, we are better. In these kind of challenges, when citizens are stretched, when the country is scared out of skin, when citizens are desperate, as a leader, as a citizen, as a patriot, you move beyond partisanship and speak what you believe will help the country. And the alternatives you're offering are not given to help the government look better or smarter. We are trying to save our own selves, our people, our families, because this is our country. The taxes we are asking of government to expend with caution is not the money from somebody's personal estate.
Okay.
We are advising on how best to utilize taxes paid by citizens, including those that support the opposition. So I don't want to read into anybody reading this as political banter, but I want to believe that it will be taken in utmost good faith that we are trying to offer the other view on how best to deal with the pandemic.
Okay.
And if anybody believes this is politics, that's their trouble. The jury is out on them, and we don't want to explain ourselves as to why we are saying what we are saying. So if we say that do not buy pickups, buy ambulances, where is the politics? That do not buy tear gas, buy oxygen. Who is the beneficiary? Is it the opposition? So we are just being patriotic. We are giving government options on how to deal with the problem, which actually it probably, on my part, it has failed to handle the diligence. I want to see General Museveni acting on the corrupt, on those who have abused these COVID funds.
Okay.
He's been issuing threats that he's going to go for them. I'll support him going for these people. And I'll ask of my committees in Parliament to move fast and go through the Auditor General's reports, make a report to Parliament, and we demand for a Treasury memorandum from government. That's the best way we can say we all acted as Ugandans, but not as politicians.
Not as politicians, not as political parties represented.
Sure.
You asked or talked about tax waivers, at least in this period. That's more of, being in a place where you're between a rock and a hard place. Yes, the tax waivers are needed because businesses are struggling. But also, on the other hand, government needs the taxes because we just passed, or the budget was just read, of the year 2021-2022. And Uganda Revenue Authority is expected to be collecting taxes because not all the budget is funded by loans. Where do we get a balancing act at this? Also looking at the economic slump down COVID-19 has brought to so many countries, including Uganda.
Maybe what you're saying is ASCAR common sense. If you demand Next Media to pay taxes when its clients are not paying, so are you asking Next Media to sell the building? It will close down. Eventually, the perspective plan of government of collecting taxes will not be realized. So we are saying, you see, initially we demanded for a relief package and a community relief package for businesses, small and big. And government asked people to go ask businesses to go to UDB. You're telling somebody running a tomato store to go to UDB and borrow. So we are telling government, look, there are simpler options you can offer relief. Namely, we know the cascading effect of fuel prices in the CPI. So reduce your appetite on the taxes that you are levying on fuel. That will have a trickle-down effect on the prices of consumer goods. In doing that, you will sustain the welfare of the people. SOPs, one of them is wash your hands When you reduce prices, VAT on water is 18%. Just waived off for the next 24 months to allow water access cheap, that you can enforce SOPs. So what will happen? And
that means the money that would have been coming from the water is waived, but at the end of the day, that money should have done something and government will get to borrowing.
But the people who are supposed to pay for water are locked at home. Their businesses are in Chikubo. You have locked Chikubo. So where is the money for them to pay the water bill?
But probably the water is still being used at home. I'm just trying to play devil's advocate because I'm trying to look at the balancing act in this.
I get you right. I get you. And we're saying if you know the permutations and triangulations that are used by revenue collectors and planners, then what I'm talking about is very feasible and they know it.
Okay.
And that, of course, will go into the Ministry of Finance to go back to the budget and look and squeeze out some of the probable expenditure centers that are avoidable. You need to simply roll back on your appetite to spend, because at the end of the day, the propensity to pay taxes in a squeezed economy is probably very limited. So even if you insist that people must pay taxes, particular taxes, because you need to balance between lockdown and welfare, lockdown and the economy, and you need to roll back. The taxes are not entirely on water and on fuel and rent. There are so many other taxes people pay. You can retain some, but stay some of them and then restore them after normalcy has returned, is what we are saying. And that will require that a bill or a motion is moved in Parliament to actually change the tax proposals for the next financial year. And it is very feasible. You may not, probably government say, we are not going to entirely roll back, but probably reduce on the threshold. Acceptable. Bring the proposals. We are saying you can do this, that some relief is made available to the businesses and citizens.
Okay.
We did demand in the last lockdown that government pays the water bills. It was done in other countries. It never was done. So what nature of relief has government offered to citizens that are suffering, that are unable to, parents have just returned children to school and have paid fees. They are home and they need water. So where's the relief from government to which people subscribe taxes from January to December? So at some stage, the managers of our government must roll back their appetite and offer governance and stop ruling. That's what we're asking.
Talking about some of the alternatives or some of the actions that government has taken to curb the spread of COVID-19, where would you score government highly? What have they done right? Because we've talked about where they've missed out, we've talked about the wrongs. Where do you think they've scored highly?
Well, depending on the scorecard, because if the score is, total score is 100, and you score 45 in one and 30 in others, and 45 you have scored highly. So I don't know in which particular component.
No. Let's not looking at percentages per se, but in terms of actions taken, what are some of those actions you think government has taken?
No, I must state that the messaging has been good, although it would have been better, because I sense that it's lacking in some way, because
what's lacking in the messaging?
The messaging should really address the trauma that is associated with the pandemic. Survivors should not be looked at as pariahs in society, and which is why we talked about in our alternative the entire treatment protocol as requiring revisitation. I talked about it, and we broke the conversation that when patients are admitted, families are detached completely from the patients. Some of the patients in admission...
Because of the nature of disease we're dealing with.
I know what I'm talking about. Some of the patients in admission require special feeding requirements. And we are saying the treatment protocol could accommodate caretakers, and the caretakers should be supported like medical workers with PPEs to support A place should be set aside, gazetted in every health center, where caretakers can be to support the patients and the health workers.
Honorable Mpoga, we are struggling with PPEs for health workers, and you would want us to add, as a country, to have an addition of the caretakers?
Why are we struggling? We offered money. Why are we struggling? Do you need iron smelting to get PPEs? Are you building a pipeline to get PPEs? These are the questions they're saying. Why would we lack PPEs? You know?
Okay.
It's somebody sleeping on the job, and these are the people. For me, I want to be really reprimanded. How do we lack PPEs? Can we see a government LPO that has not been honored and was outed 6 months ago, and the PPEs have not come through? PPEs that can be locally manufactured, and we cannot have them. So that for me is criminal, and we are saying the game must be upped.
So you need the treatment protocol to change to accommodate caretakers.
Yeah, exactly. Caretakers, because doctors will health workers will tell you, we have them, we leave them in the community, they will tell you actually that some of the deaths are associated, many actually, are associated not with the COVID, but with the attendant care, including feeding. Because doctors are linear, medical workers, health workers are linear in their approach. It is, he will have medicine at 8 o'clock, at midday, and the feeding is different.
And they're paying attention to me.
They're not paying attention to it. And people actually losing the battle because they cannot speak to their loved ones. Some of the deaths actually are psychologically caused. You are isolated, and it's like you are gone. You speak to no one. There are no options. You can't ask for warm water. You can't ask for a juice. You cannot say, no, this is acidic. I need something non-acidic. The feeding habits are different. So we are losing partly, the mortality is partly because of caretaking. Okay. And we are saying it needs to be revisited. Are we asking so much when we ask to be revisited?
Not.
So who actually did construct it that when somebody is admitted, they should be completely detached, you know, and all they're eating is oxygen? So there's a problem.
So you actually, before we went to that, the treatment protocol, you were still talking about some of the positives. You talked about messaging, but needed to be changed. What else do you think government has done right, or has done right, but could be better?
Yeah, I think I wouldn't be having this conversation if lots of things have been done right.
Okay.
One of the issues, for example, we raised that there's collaboration between government and the private health service providers, which we are saying is at this stage very flimsy and needs to be upped. We know for a fact that there's not just a thin spread of government facilities, but they're also inadequate. And therefore, the private providers could have augmented the government.
But the pricing?
Yeah. And that's why you have an entity called government. That's why you have a justification of having a government. Governments exist for those very reasons, that when a country is in a crisis, you reach out. You do not intimidate. I saw somebody saying they're going to arrest, blah, blah, blah. Do you pay their taxes? Did you build that structure for them? They have a loan in a bank. Go and speak to them and know how best, given the crisis we are in, we can work together. You have NMS procures drugs for government. Can you, for example, make drugs available to the private providers and only ask of them to charge a handling fee as a way of saving the country from a crisis, instead of intimidating them with arrest, which is actually illegal, and out of thought. So, certain things can be done. I'm still saying somebody is sleeping on the job. They need to think out of the box. These matters cannot be solved with linear thinking. You need to think better and outside the box to be able to deal with the pandemic. In my sub-region in Masaka, the better facilities are owned by the religious institutions. What is the level of engagement with them to make sure that the medicines are available and affordable, that you can limit the handling fees because you have availed the drugs, and they offer some compensation to these facilities because they are actually private.
Okay, I see quite some work there for your committee, the Parliamentary Accounts Committee, in the few days or months to come. But as we get to close this off, what seems to be the most affordable option currently and most convenient option is going to be prevention. What alternatives do you think could be coming through? Because in prevention comes feeding, the prices of some commodities are high. Lemon selling for 1,000, one piece of lemon is quite extraordinary. Where do you think the population now should be taking the path of prevention as a leader? What alternatives?
You know, it's an array of things. Some of them are with the population, the others are with the government. Surveillance, communication, testing, immunization. But of course, the population has their part. But they can only take up what they have been told about or informed about. So communication must really continue flowing, okay? They must get messages. But also, government must not cease in surveying and determining the epicenters such that the communities can avoid. Targeted immunization, targeted testing. We have interactors. I've talked about them, interactors like border borders, like taxi drivers. Of course, the teachers were initially addressed. This should be targeted for both testing and immunization. That when you lock down for 2 weeks, you actually test prevalence after immunization. Because we do not know, for example, what percentage of the immunized have actually contracted the disease after. We do not have that information. Actually, that we can compel people to really participate. People are scared of immunization. We need messages that really can buttress immunization. And also testing. Testing centers must go to the communities. Testing should be made easy. The nearest health facility in the communities is the health center 3 for every, I think, sub-county. They don't exist in some sub-counties. But the testing centers should move. That will go hand in hand with the recruitment of more health workers. Apparently, there's a lot of stress on this part of health workers. The question of the day, how many health workers were recruited at the first lockdown? Was it envisaged? Or they thought it's not necessary? And therefore, it was not necessary to buy pickups. So what happened to the planning function of government?
Okay.
You know, talking about health workers is part of the problem that explains the high mortality. Because these people are stretched, they do not have PPEs, they are exposed, they are scared, they will take to their heels, and all of us will be in trouble because they are human beings. They have lost some of their colleagues and scared the hell out of them. So what happens? So do we have a risky pay? I saw a saturating, I hope it was actually wrong, I'm waiting for the minister to explain, that there was an order to pay 5,000 and a risk allowance or extra pay for extra hours. This is abusing the intelligence of our health workers. I'm sure you saw it.
Yes.
Did you get an explanation?
It's something that you cannot be able to comprehend, but we do hope that it was.
So there are simple.
It was wrong.
There are simple things, simpler things to do before even talking about ICUs. You know, is recruitment of health workers really a requirement that should take us generations?
Of course not. Honorable Matthias Mpuga, time is fast spent, but finally I'll give you a minute or two to speak to the public. You are a leader and you clearly have seen what is happening with a disease that can easily be controlled, and yet it seemingly is getting out of hand. We'll take your final message to the Ugandans.
Yeah, media and viewers, of course, we're all affected. The communities are psychologically affected. The deaths are everywhere. At least every family has tasted death. In fact, part of my concern is that probably the declaration of the death are not coming out through to even send a standard message into the communities. I want to ask of our people to observe the SOPs, very important, because the treatment is non-existent. There's no ICU. There are no ICUs to that where you're going to survive. And once you go in, survival is problematic.
Yeah.
So you're better off keeping safe wherever you are. But also invite all government to act on some of these basic proposals we have made because they are feasible, they have done elsewhere. We're not reinventing anything. We're only agitating what has been done and successfully elsewhere.
Yes.
It can also be done here. And we ask of government players not to stop looking at us as trying to partake of their lunch. You know, this is a problem all of us must share and find a solution transparently. Transparency must be the middle name for undertakings, for all activities,
yes,
to try and roll back the pandemic and its effects on our people.
Honorable Matthias, ngenda kusaba obubaka obwo buddemu eri abantu b'e Masaka, eri abakulaba. Bubaka kibo abantu mu kaseera kano kuba okutya kungi, abantu bafa, obulwadde bungi, naye ng'ate kino ekirwadde kyekimu ku ekyo ku birwadde bye tuyinza okuba nga twetangira bwe tutunuulira ab'ebyobulamu be batugamba.
Mildred nga bwe ngambye mu lunabudde olusoose, kutegeeza abantu baffe nti obulwadde buno ekisooka bwa bulabe nnyo, naye ate busobola okwewalibwa. Buli famire ekirozezaako mu sabbiiti 2 naziika omusajja yali best man wange.
Wow.
And actually my best friend of generations. Ennaku 4 yali amaze okufa. So okufa si lugambo, obulwadde bungi, abantu baffe tubasaba gye musobola okwewala mu byewale. Bwe munaalinda ebya gavumenti, kase ebya gavumenti yammwe mubimanyi. Bw'obanga tewasobola kufuna bijanjaalo naye ng'osobodde okufuna eddagala, kiyinza obutabaawo. Kino tekiriimu bya bufuzi, lutalo lwa ffenna, ne bannabyabufuzi kye balina nti bavunaanyizibwa okubaako kye bakola. Nga bwe mubalinda musooke mwerinda, okwerinda si buti, kye tubasaba, tulowooza kisoboka, ebisigadde tubikole nga tuli balamu, tewali mufaanyi ya lutabaalo.
Exactly. Well, thank you very much. Tweyanziza nnyo obubaka butuuse bulungi, and we want to thank you for sparing time to come through and for the engagement that you're putting forward. The onus is on government to take up some of these proposals or to actually go ahead and neglect them, or to better already the actions that have been taken into consideration. Like the Honorable Matthias Mpuga did say, the standard operating procedures are key. Before you wait on what government can do, what can you do for yourself to prevent yourself or your family members from contracting the deadly COVID-19? That is the food for thought I do leave with you. A very good morning to you. Thank you for being a wonderful audience.